Today, we're going to be talking about navigating the future, how regulation is going to affect artificial intelligence, generative artificial intelligence, and also in healthcare. We've got a lot of stuff to go through, so we're going to jump right in. We're going to just do some quick introductions for those of you that have not joined us before. I'm Tom Riggins. I'm a senior manager at SAS. I'm our global lead for all healthcare fraud, security, and compliance. And I'm joined by two members of my team today that you see there on the screen, and I'll let each one of them introduce themselves. First, we'll just jump into Jason.
Great, thanks, Tom. Yes, I'm Jason Denovi. I'm a healthcare fraud analytics consultant here with SAS. Been here for a few years, and prior to that, worked for some commercial health payers, actually building out some of the analytics to detect fraud, waste, and abuse. So we've done that from within the Special Investigations Unit, providing leads out to investigators, and have also done this in the payment integrity space as well. So looking forward to the conversation.
Good morning or afternoon. I'm John Maynard. I'm a principal industry consultant on the healthcare and compliance side. I work with Tom. My background has primarily been government, so Medicare, Medicaid. Worked at the state for 25 years in Ohio, was the PI director there, and then I support the commercial payers, the PBMs, and healthcare systems, wherever around the world, wherever Tom and anyone sends me to do something. So there you go.
Excellent. Thanks, guys. So a quick rundown of our agenda today. We're going to talk about artificial intelligence and generative artificial intelligence. Hopefully, we're at the point now, a couple of years in, where people understand the differences of those. We're going to talk about the current regulatory landscape that's out there. And then we'll talk a little bit about what trustworthy artificial intelligence means, and then really just any additional considerations. For those of you that have participated with us before, we have a big old conversation, have a good time about these items. We're not going to read our slides to you. I will tell you that the slides will be available after the session, so you don't have to take copious notes or try to record this. You can get into it and see the recordings at will on demand if you've registered, as well as getting access to the slides and some of our other collateral that's available out there. So we're going to jump right in and sort of talk about a couple of things. This is one of my favorite slides. This is the inconvenient truth. And one of the things we like to do when we're doing this session live, and of course here we can't ask everybody to raise their hand and see what your hand looks like, but I'm sure that everybody that's on this webinar has been asked by their management or by legislators or by presidents of companies or things like that, hey, we want to incorporate AI into what we're doing, and can you guys help us with that? And so a lot of people say, this is what our company thinks AI looks like, which is that data comes in, this magic AI stuff happens, and then we determine new value from what's coming into the system. And a lot of people believe that's kind of how it works, right? You've used ChatGPT, you've gone out onto the web, you ask Gemini to create a picture of something, and it just poof, magic, it does it. But the inconvenient truth really is that this is what artificial intelligence really looks like. And there's a lot of stuff that goes on behind the scenes, a lot of important items that you see here around data and the data engineering and the operationalizing of things, as well as the things that are going to be hit, and we're going to talk more about today, around the legal ramifications, regulations, the constraints that governments are going to put on to AI and generative AI, as well as some security issues that we go in. So hopefully, we're going to have a conversation around all of this, and you'll come away with a greater understanding of, should we be using AI? Should we be using generative AI? And what does that really mean for our businesses as we move forward? That's one thing I'll just quickly say, and then I'm going to hand it over to Jason to sort of talk about what all this really means. But you're going to hear us today talk about AI, and we'll try to refer to that as traditional AI and generative AI as two separate things, even though they sort of are under the same umbrella. And I'm going to show you that umbrella and hand it over to Jason, sort of give us some identification about what is this big difference here between generative AI and artificial intelligence. Jason.
Yeah, absolutely. And so, that's really the thing. One of the difficulties with artificial intelligence is just how broad the definitions can be for it at large, right? So sort of that traditional AI. So, what we tend to define it as is really anything, any kind of system that can accelerate, any that can replicate what humans do, whether it's decision making or whether it's actions, and generative AI is just a really specific subset of that. So what it does is, we think about training traditional AI models, we put in sample data and then we get results, we get predictions. But generative AI is actually taking that sample data and it's creating more sample data. And that's literally the content that it's generating. So, it's a great illustration here because it shows you how you just have, just the huge bucket that is artificial intelligence, right? Anything really that we're trying to replicate that people do. And then you have that sub-content that is machine learning. And I think that's what a lot of people tend to think of when we talk about algorithms, when we talk about models, right? That pattern detection that goes through large amounts of data and then helps us in terms of, getting insights and making decisions. So then deep learning becomes a more complex version of that. That's when we start getting into neural networks and things start getting a little bit opaque in terms of how those decisions are made. And then generative AI is yet a smaller subset within deep learning, and that it also takes advantage of natural language processing, right? So just the way that we speak naturally, general natural user inputs, right? Notes, comments, things like that that we tend to put into systems.
Yeah, excellent. Thanks for that overview, Jason. So John, one of the things that I know a lot of people have talked about is, so what are some of the challenges if we're going to start using this generative AI? My boss told me we gotta start putting generative AI in everything we do. What are some of the things that we need to be, concerned about? What are those challenges? Can you talk a little bit about some of these issues, and we'll sort of start that conversation around that?
Sure. So I think obviously there you have accuracy. So we're looking at those large language models, and the output that they produce can be incorrect. So it's not contextual or it's nonsensical. So it's taking the information that it has, and it's been learning from responses what's the right answer and how things might actually be connected. But it will sometimes connect things together that don't make sense. And it has been known to create things that didn't exist. So I know one of the things is we had an attorney who used it a little bit to sort of check things, and it gave him these legal citations which he used in a court, which turned out to be not really true. It just sort of created some of its own, or it had created some for somebody else, and then it went back and cited them for him. Knowledge cutoff date. So, understanding what the data is that's in there and how fresh that data is and how it's been used. And then it relies on context. And so I can see Jason's probably chomping at the bit, because Jason is probably like the best prompter that I know in the world right now. And that's going to be a job. Like how you ask it questions, how you go about engaging with the application is going to affect what comes back to you. And there's an art to that. And I think Jason is quite the artist. And then there's hallucinations. So it just creates stuff that's not even real. So you have to think about that. Privacy and security. One of the
things for that hallucinations, John, and you were mentioning about that attorney that submitted a case brief that cited precedent that actually didn't occur. But one of the concerns about that is that he submitted a case brief with precedent cases that didn't occur, but that case brief actually then becomes part of that large language model, that data that's out there on the internet that then gets repeated back because somebody else is going to say, hey, how did that case go? What's going on in that case? Or, show me some precedent. And the next thing you know, that information is then repeated as truth. And I think we've seen that this summer. There were a number of cases where, clinical research papers from universities were having to be recalled because it turns out that some of the data that they were using and references that they were using was actually all false. And because it is out there on the internet, it becomes truth for somebody else to use. And so there's great fear, that these large language models, and jumping into the privacy and security here with Jason, yep. That they can be manipulated to say kind of what you want them to say, right, Jason?
Yeah, that's exactly it, right? So of course guardrails are in place, but there's just so many ways to be able to break those. And I think some people imagine that to be something in the background that's very complex, as if you're doing some kind of hacking or something statistical by playing with weights. And that's one potential way to do it. But literally just by doing something simple, even describing, I need to do something for an academic paper. So now I'm going to ask how to avoid, creating a bomb, creating, a certain topic that obviously you're not supposed to have information towards. It's just very, very easy to get around these with very, just again, these are simple constraints that are here. And, I would also say too that just while we're talking about generative AI here and the challenges that arise, that a lot of this does still apply. It's something that we're kind of used to with traditional artificial, right? Those cutoff dates still apply with the training data. Context, I mean, you can really think of that, the context really just being that the rule of if you have bad data in, you're going to have bad data out, right? So it kind of follows that same rule. I mean, same thing with privacy and security. Obviously, that's going to be paramount, right, for everybody. We need to be able to trust that the data that we provide, right, because a lot of this is intimate healthcare data, is actually going to be safe, right, when it's submitted and when it gets used.
Yeah, I think as we go through, and we'll talk more about this as we move through the topic today, but taking these things into consideration when you are deciding, you say you have a use case for using generative AI in your work, and it holds some great promise, but have you done the due diligence to look at what are the constraints, what are the fears, do we have the privacy and security? Do we have, the next bullet that we're going to see here, data governance, which is huge here. I was talking with somebody in Tennessee who actually has implemented a generative AI model in their Medicaid eligibility system, which is a great use case. All it's doing is giving them access to their actual policies and bringing them up faster, and being able to quote it rather than having to do like a control F find within PDF. So it's a great use case, and it's not something that's risking any decision making. But the reality is that it's self-contained. Do we really need to do this? Have we thought about this? And one thing that they really learned about data governance was, you got your data that you're going to use to build these large language models and use generative AI has to be near perfect. Otherwise, you're going to have mistakes, and you're going to have things that are being reported. And that's what they actually found, was that over time their policies, something was called something in an older policy, and then they changed the terminology of what it was called. Well, the generative AI models see that as two separate policies because there's different wording, even though it's the same thing. So being on top of that data governance and understanding how it's still just a computer, it's not thinking on its own, it's just repeating back, what it has been programmed to do is one of the vital things as well. So areas of legislation. This is something that, the whole talk today really is about this, since we've set up this knowledge base of generative AI. But one of the things that we've all been very concerned about, and we're advocating for not only our state folks that are involved, the federal folks that we deal with, but also in commercial healthcare as well, is trying to figure out what areas of legislation are going to be affected by generative AI or the use of generative AI, and how can we get ahead of some things so that we're not hamstrung by legislators who don't really understand what they're doing. And so this is a great place to sort of jump into that. And I know, Jason, you've done a lot of work in looking at where we are today. So this is some of the areas that we think that legislation is going to come to impact, right?
Yeah, exactly. And so as we get a little further along too, we'll look at some specific examples, but there's just a lot of pending legislation that's out there, right? So trying to navigate that, try to identify these commonalities. We already kind of went over security. So I mean, cybersecurity is clearly going to be paramount. I mean, think about what happened with Change Healthcare several months ago, and we're still feeling the impacts of that. I know I will actually just, I will admit, so I just got a letter that, someone in my family, actually their information was compromised. I just received that letter last week. And again, that was something that had occurred back in February. So, I mean, that is, again, just one of the most paramount considerations. And so there's going to be a lot of laws for tightening up really the security of data so people feel safe. Clinical decisioning as well. Obviously, anything that's going to have an impact on the course of people's care, right, and their treatment. And then even beyond that too, I think just some of the additional tasks that providers' offices have to engage in, getting prior authorization, some of the administrative things as well. Those are all things that are covered, and really the automation levels of that. We'll see some examples too with coverage determination. So anything that has to do with claim denial, partial claim denial, utilization management, we start seeing a lot of language developed and a lot of targeted laws really just around that. And then, we'll start getting into some of the characteristics as well, sort of what to anticipate and what can you build into your governance system. Transparency and explainability is a big part of that. So, and with transparency too, I want to clarify that I think there's a couple sides to that. So there's the transparency that's for the actual the person who owns the data, right? Say the beneficiary who actually needs to be able to consent to providing their information and consenting to artificial intelligence algorithms actually looking at their data. But then on the other side is really sort of that explainability, right? The transparency into the model, so that whether that might be that regulators can actually be able to assess, what's happening with these models, or simply whoever develops them can actually explain them, right? So just not having these opaque models without being able to explain those decisions. And I think
that's going to
too.
Yeah, I think that's going to be a big one, Jason, right, John, is that, having that data lineage of where did you get that answer from? How did you determine this? How did you make this determination? You can't just say, well, the computer told me to do it, right? That's not how this is going to work. And I think that's one of the concerns, you coming from running the PI department in Ohio, a lot of that decisioning really has to be explainable in a court of law, or during an audit or an appeal. And so I don't know if you've had some other thoughts on that as well.
Yeah, I think it gets to what Jason was saying about the deep learning and the neural networks and the opaqueness. So, when we did statistical sampling and we wanted to project it to a population, and then we would sort of get a high-low number, and that's our bargaining points for recovery with the provider. We would have appeals where we had a statistician who taught healthcare analytics and built the program at Ohio State, who had to go in and defend our work, right? So just that. Now you're talking about an AI model that's neural network based, that's deep learning, and someone's trying to explain what it's doing. And I think what we've seen is that in where folks have applied stuff like that, and then they've gotten tied up in the legal system arguing over how was I treated fairly and how's this working. They've not been able to always go in and explain exactly what it's doing, and that transparency and explainability has become very, very important, because I think some of those cases they've either lost or they're on their way to losing because they just can't explain what it was doing, and therefore they can't explain that it was the right action to take, the right decision for what was happening. And that's been things like, paying claims on providers, and who gets in and out of things. And but even outside of healthcare, we've seen weird things, I think, where people were using facial recognition or something to decide if you should hire somebody. So there's some strange applications of this stuff, and we have to be thoughtful about, do we actually understand what it's doing and how it's doing it? And I think we'll talk a little bit more about those things, bias and those things, here in a second.
Yeah, absolutely. Anything more you want to talk about on the sort of the areas, Jason?
No, I actually, just because John brought up, we've already seen, right? We've seen actions taken, right, for things like automatic down coding and just algorithms and things that we're used to. I think it's actually a good transition to move on. Because again, we can start talking about some of those definitions, sort of the broadness. I know you promised, Tom, we weren't going to do any reading. I'm going to do just a little bit here. But, if we look at this quote, right, this actually comes from a U.S. senator on a sponsored bill, an Algorithmic Transparency Act. And his language that he uses in it, artificial intelligence powered systems, from cutting edge generative AI systems to simple rule-based automation, increasingly making critical decisions about Americans' health, finances, employment, and going on. But the point being here that he really lumps in everything from cutting edge generative AI to rules-based. And so that's something that obviously we've all been using for several years, 15 years or so, right? Has been part of claims adjudication systems. I mean, even something as simple as NCCI edits, right? And then just having an automated way to go through those and then have partial denials. This is something, this is the most alarming thing to me, right, is that now we're going to talk about pending legislation that's going to be not necessarily focused on the sophistication of the different types of technology, but really more about the use case and what's happening, that it can include things we've been used to doing for years.
Yeah, and I think this is one of those areas where a lot of people haven't realized that because generative AI is not this thing over on its own, it's part of that artificial intelligence umbrella, that when these legislators who really don't have a great technical understanding of what they're talking about start making rules, it can affect a lot of things, like you said, that we've been using for a long time. And so, one of the things we've been trying to communicate to folks is that this is where you need to start interacting with your legislators. This is where, commercial companies need their lobbyists to start sort of, giving the terminology, helping the folks that are going to make the rules understand what some of the things that they're talking about actually mean, and the fact that we've been using, here at SAS, we talk about it all the time, that, we've been using artificial intelligence, the global artificial intelligence, in our solutions for over 40 years. It's nothing new to us. It's not a buzzword to us. But you think about, all the systems out there that are using some form of deep learning or machine learning or, just general AI, and these regulations can affect them. And so, getting in with these groups, which we'll talk about here, some of the regulatory groups that are going to be involved, I think, getting ahead of it and making sure that they understand the ramifications of the legislation that will be pushed down, because it's coming. It's coming for sure.
Yeah, it is. And so, really just want to outline here. So this is really at the federal level. And right now, there's not a great deal of regulation of the United States, right, at the federal level. There's the executive order, Biden's executive order from about a year ago at this point. And the goal of that really is even just to create the resources, right, to create the structures, the resources, to even just start taking in data, start understanding what trends we're beginning to see before we even really start getting to the regulation part of it. So we want to try to, because we don't have something, just at the federal level and something that's going to encompass everybody and everything, try to anticipate, how can we, I guess, build, I'll call it guardrails, I guess, into our programs, so that we can be in compliance when later regulations, maybe at different state levels, start to come in. And so, but wanted to note here, that part of that executive order, created this very easy acronym here, ASTPONC. But yeah, so this is brand new, or I guess news of several months ago. The Assistant Secretary for Technology Policy, Office National Coordinator. So again, this is really just for reference, so people can look this up later, because likely this is where you're going to start seeing more guidance, on artificial intelligence and technology and specific algorithms and how it's going to be used and how it's going to be investigated from HHS.
One of the things with that, Jason, if you remember when we gave this talk at NAMPI back in the summer, that CMS was there obviously, and CMS did a keynote lecture in the morning, and a couple of the questions were around, hey CMS, do you have any guidance available for what we should be doing with generative AI? And CMS kind of went, no, not yet. We're thinking about it. We'll get back to you. Those were the kind of answers. And then some of the folks from CMS attended our session, and we were actually probably a couple steps ahead of where they were, John. And that's happened to us before.
Yeah. And coming from the regulator, so you might come from stateside as a regulatory environment and a compliance person. What I know is that we're generally chasing things in the business field from the regulatory side, and technology in particular is a space where we've always been behind. So we are behind, and it didn't surprise me that CMS didn't have answers. And the thing about it is, and Jason always says this really, really well, is that Gen AI is here now. Like, we're seeing it, and it's infiltrating many, many things, and it's being productized all over the place. But 2 years ago, if you'd asked somebody about Gen AI, they said, yeah, it's going to get here. It has moved very, very quickly. And, it's hard for regulators to keep up with that. And so I know the people who do that work, and they sit around in rooms and they blah, 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 and they talk about it. And you have elected officials and you just put that up there. When they paint with a really broad brush like that, it becomes dangerous. You have to be very careful about the words that you put into law and words you put into regulation, because there's always those unintended consequences of what you say. And I've been the victim of those, where I've been told I can't have access to data because somebody looked up Joe the plumber's child support. But, there's stuff like that can happen, and so. But what I would say is that for our folks that are listening, you have to try to make sure that your lobbyists and your government legislative people are paying attention to this stuff, and that you have a voice in it, because you don't want it to be done to you. You want it to be done with you, and I think that's important.
Yeah, absolutely. So Jason, I know you've spent some time sort of doing the research on where are we, that was sort of the federal groups that are in charge of the regulations around this, but where are we with some of the state regulations that are coming down the pike, or maybe already are there? And I know, when we update these slides, we're always like, oh, that one was passed, or this, this came to be, and those type of things. So this is like sort of leading edge information, right?
Yeah. And so for clarification, most of these that are here, are proposed legislation. So they're all in various states right now. But this is likely what we're going to continue to see going to the future, is going to be just this kind of woven tapestry of just different state regulations. And so just not necessarily going through all of them, but we'll touch on a few of them at least. And Colorado was actually the first to put in an algorithmic discrimination act, and so I think that was 2021. So that has passed, right? So they actually need to meaningfully be able to demonstrate, right, that they are taking all attempts to mitigate bias when they use algorithms to make decisions that are going to have real impact on people. And now they're going further now with actually mandating governance and a risk management framework. And something that I neglected to mention on the last slide is that right now, while we don't really have much federal regulation, we do have some guidance. And that comes from NIST, or the National Institute of Standards and Technology. And so they have what's called a risk management framework. So that's a great, I think I have that on a different slide too for reference when people want that later on. But it has, describing the different characteristics and a lot of best practices that I think a lot of these laws that are being crafted, they're taking those, directly from that NIST framework. So it's just a great place to kind of use a little bit as a crystal ball, I think, to see what's coming up. The one that did pass, I will say, is right below that. California is the physicians make decisions law. And so what they want to do is, the whole goal is to really make sure that they're keeping a human in the loop. So impacting utilization management review, anything having to do with medical history, anything having to do with prior authorizations, or really this is claims coverage, right? They want to make sure that there actually is a licensed physician, a medical director, who's going to be involved in those decisions rather than letting algorithms just automatically make those decisions.
Yeah, and that's something I advocate for, is keeping the human in the decisions. So I have an eligibility background too, both for Medicaid and for other things like SNAP and TANF and childcare and such. So I always think the human being needs to be there making those decisions, and you can augment it with this technology. But I've written stuff where I've talked about specifically that topic, and someone asked, will AI replace the fraud investigators? And I don't think they will, because fraud's determined in a court of law. So someone has to gather the evidence, and someone has to get it to a prosecutor and go through it in court. And the investigator is an essential piece of that. So I don't think they're going to replace, but I think it's going to augment what investigators are currently doing, and it's going to change how the job works. And one of these guys I was talking to them, there's a guy named Mark Wolf. He's a PhD. He's an advisory industry consultant here at SAS. And he's the chief health strategist for the SAS Global IoT division. So IoT is the Internet of Things. And he actually also teaches at the University of Miami in Florida. But, if you ever get a chance to get near him or read his stuff, there's really interesting things happening in healthcare and sort of how services are delivered that I think is going to affect PI in the future. So I was talking to him about intellectually developmentally disabled people that are living in group homes, or an IDD group home. And you have somebody there who lives with those folks and watches over them. But the idea was that you could put cameras in there to replace them, because having a live-in doesn't always work well with that population. And then you have 24-hour care. So can you do it with a camera? And then can you build AI models to sort of keep an eye on them and sort of flag a human when it looks like they might need intervention? That stuff is on the way. Mark's talking about smart homes where TVs remind you to take your pills. They will monitor your daily routine and flag something if you're off, like especially for the elderly and the disabled. Things like electronic pets, that are checking your blood pressure, helping you out. And also smart homes where there's cameras and they're watching your movements and identifying changes in your physical movement that could make you at high risk for a fall or something like that, or your eating habits. And it's just predicting, your body temperature, because you can have a smartwatch or something on and sensors in the home that's sharing information. Like, this stuff is coming. Some of it's already been built. That's going to change how health care is delivered. It's going to change the type of data that's being collected. And so then I'm sort of thinking it's going to change PI. And Tom and Jason and I were talking earlier. I said, if you've got a camera in the home that's watching an elderly person, then if we think about electronic visit verification and how that gets done, there's a camera that can say, did the home health aide show up? How long did they stay? What did they do? That is being collected. So can PI get their hands on that? Should they get their hands on that? Tom called it EVV on steroids, which I think is a good name for it.
Yeah.
But that stuff's coming, and so that data is going to be generated. And I think PI teams and SIUs need to be thinking about, can we get access to it? Should we have access to it? And how will we use it?
Yeah, I think some of the guardrails we talk about, I mean, this is where, not to quote, the Terminator movie or things like that, but as we are replacing repetitive, boring, you might want to call it, work that humans do, what are the guardrails around that? Why, what are these regulations going to do to help us to build that out? And you bring up a great point, John, is that, we also get special permissions, right? So there's law enforcement has, the right to look at certain things that the general public does not. People who are investigating potential, fraud, waste, and error in healthcare claims, we have access to information that other people do not. And so, a lot of that's going to come into play. I mean, I think about that EVV on steroids. The beauty of it is like, yeah, that's great. You've got an EVV system. We all seem to know what those are now, but if you have that generative AI camera or that AI camera, you can actually prove or disprove, that the care was actually delivered, not just taking somebody's word for it on their clinical note. So there's definitely going to be opportunities for this to be seen and used in what we do. The other side of it, on the PI side and SIU side, is that, how is this going to help us in what we do? And I think that's where those efficiencies, you talked about replacing investigators. I don't think it's going to ever replace investigators, but, Jason and I talk about this all the time. It's going to make the job a little bit easier because you can have, right now you can do it. Go out on the internet browser, Google, whatever it is, and say, summarize this web page for me, and it will provide you a summary, or summarize these documents. And so think about that. Instead of having to read through a patient's, entire medical record that could be, voluminous, thousands of pages, you have the ability to have generative AI go through that and provide you a synopsis, or go looking for a particular treatment that was given, show me the documentation around that. Just the speed with which that can happen is going to be really impressive. And I think we're going to see a lot of movement in that area as well. But again, this is about the regulation. And so we have to make sure that we stay on top of that. Jason, were there any other states that you wanted to just touch on before we move on?
Yeah, just real quickly too, because we talked about that physicians make decisions. Also just want to point out that with Georgia, they also have the AI for coverage determinations, and it's in the similar vein that they want to keep a human in the loop. So I really just want to draw that together. That's going to be a common theme with a lot of these, that really, because we're getting at questions about automation, there are a lot of efforts, there's a lot of attention being paid to just this idea of complete automation. And so they want to make sure that, there's, I put in quotes, meaningful human review. I'm curious from a legal standpoint, kind of what they're going to define as meaningful. I think that's going to become the ambiguity there. But what's nice, and I mean, it seems that these are really trying to protect, say in this case, the beneficiary, right? The people who the decisions are being made from, or for. But at the same time, there are people then who need to do this work. So it kind of inherently also winds up protecting people then in terms of keeping jobs from being automated away. So point that out. And only one more, that with Pennsylvania, just this certification for algorithms used for utilization review. I mean, this literally the idea, I don't know how far this has made it, but the idea that you may actually need to submit an algorithm and training data to an entity to review these and make sure that they're compliant. And so especially as John's talking about just the wealth of different types of data that's available, that will always be another consideration too, is what is going to be the policy? To what degree am I going to be able to reproduce all of this? And am I getting enough value from this data? So, sharing that one too, but yeah, I think that's good.
Yeah. So one of the things that we also want to talk about is, because NHCA is US based in some ways, but we also have international membership, is that there are some folks that are sort of getting ahead of the curve here. And the EU actually created an AI Act, which went into effect August 1st of this year, with a gradual rollout, obviously, of 6 to 36 months. But that's one thing that they sort of are a little bit ahead of the United States in, is this this sweeping legislation that's been put in place. And what it did that I think is really very interesting is it established sort of a common framework for how regulations need to be put in place depending on what the AI does. And I think that's kind of a real, in our next slide, we're going to go over that, but that's one of the key things, is that understanding, and this is where we talk about when people ask us, well, should we use generative AI for this? My saying is always like, start, crawl before you can walk before you can run. And so what is your use case? What is the problem that you're trying to solve? And do you have to go with full-blown generative AI solutions to do that? Or, can you just use predictive modeling? Can you use standard traditional AI? Or is it something that is really very useful to use a generative AI? Having those conversations and not just jumping in, into the lake with both feet into generative AI at the first inkling of being able to use it is going to be really key. And, John, you mentioned, 2 years ago, a lot of people didn't even know what generative AI was. And, it's funny to me that here we are 2.5 years later, and all of these companies and these entities and government entities are so eager to just jump in and use this stuff. 2 years ago, we didn't even know what it was. It's amazing to me that we're wanting to move that fast.
But it's also like cloud computing was, 5-6 years ago. I mean, when I started at SAS 6 years ago, the government just wouldn't want to go into the cloud. They were so hesitant because of security issues. Now all the government entities are like, we're going to the cloud. But what you're saying, Tom, is don't use a chainsaw to cut my fingernails. Use an appropriate tool, and Gen AI is a tool, and I think that's what we need to keep in mind, is that you want a tool that's appropriate for what it is that you're actually trying to do and the use case that you're going to solve. Because there's many tasks people come and bring to us and folks we work with, and they say, I need Gen AI for this, and they're like, no, you don't need. Basic algorithms could do that. We've done it for 25 or 30 years. You don't need Gen AI for that. So be thoughtful.
Yeah, absolutely. Jason, you want to hit a couple of these? I know I want to talk about a couple of them too, but this is that risk pyramid that the European Union put out, and I really like it because it does sort of categorize where generative AI falls within risk. And I think that's sort of one of those first questions that should come up when you're evaluating this stuff, is like, okay, what is the risk of what I'm trying to do, right?
Yeah, exactly. And so, this coming from the EU then as well, what's really relevant then is that, it's very difficult to understand or to try to predict, how are we going to actually deal with the specific advancement in a technology, right? Or how are we going to regulate something just because it's of its sophistication? But something that we can do, what we're often seeing, is that it's going to be based really on what is the technology being used for, as opposed to exactly what the technology is. And a huge part of what it's being used for is going to be associated then with its risk. So, if you go with something like minimal risk, think of something like a recommendation system, right? Whether you use Google Music, or whether you're watching something on Netflix. If it gives you a bad recommendation, the risk is rather low. It might ruin your evening, but it's not actually going to create any real harm to you, right? So it's trying to think about if there are errors or if something is used incorrectly, what's that risk going to be? And so limited risk too, that's when we start getting into chatbots and, something where now you're interacting, now you're potentially getting real information, particularly from a private entity that might make some sort of promise. I think, was it Air Canada got in trouble because their chatbots promised some sort of huge discount to someone for a bereavement policy, which they shouldn't have been entitled to. And that really blew up on them. So then you also have, and I don't know, Tom, if you want to speak to more of the high risk and some of the unacceptable risk categories.
Yeah, just
too.
a couple quick comments. The thing you talk about with the chatbot promising things, that's one of the things, going back to where we complimented Jason on his ability to write prompts. That's what people are sort of having fun doing right now, is they're trying to get these generative AI chatbots to sort of do the things that the guardrails are set up to not allow them to do, like offering discounts and things like that. And the way you ask the questions sometimes, gets it confused and makes it answer in ways that it's not supposed to answer. The other thing is, like you said, while it's minimal risk, just personally, I don't know what the algorithm is that Netflix uses, but just because I clicked on one thing doesn't mean I'm going to like all those other things that you just brought up in front of me too. So I think while it's minimal risk, it's annoyance risk that's pretty good. But go ahead, John.
And so for this one, what I would say is I have seen this recently in a meeting, and I knew I had seen it before, and I realized it was Jason who had showed it to me a few months ago. But we just flashed it up and we talked about it. But I've been doing a lot of work with R&D this year, And I ended up in the last month actually in meetings where this was put up, and our lawyers went through with me and people who build such things and started going through these questions of what is it this is designed, what is it supposed to do, where is it supposed to go, who is it supposed to be for, what are the effects of it, like just bombarded us with these questions. And so they're being really, really thoughtful about this. And you have to understand, well, how will this be used? What risk does it present? And they asked us questions about how could it be abused? If somebody turned it in the wrong direction, what would it do? You know, we have to define the use cases. So this is actually real stuff. And I know because I've had to run the gauntlet with some smart people who build things. I bring the business stuff, but I had to sit there and go through this with them and explain, like, this is what it's doing. This is why it's doing it. This is what could happen. This wouldn't happen. Here's a side effect. Yeah. And we'd actually thought about all of these things. And, so it's real, and it's what should be done, because I'm always concerned myself about turning something loose into the wild and not understanding what it's going to do. So I'm pro AI, you know.
Yeah.
But,
well, you know, we here at SAS, we talk about, you know, trustworthy AI. That's what we're pro. We're pro trustworthy AI. And,
Thank
you know, the two highest levels here, when you know, I'm not going to read the slide, but, you know, the two highest levels here, you think about how these things can be used. And we had a question pop up in the Q&A around, you know, would that video monitoring be available to the public? And, you know, obviously here in the United States, we have HIPAA privacy regulations that would control that. But as we use technology to record things, I'm very fond of saying, if it has a battery or plugs into the wall, chances are it's capturing data. Whether or not it's connected to the internet or not, it is capturing data and transmitting it to something, whether it's a little internal hard drive or whatever it might be. And all the people, you know, here's my scary stuff that, you know, my kids hate me because I never do any of the, you know, Siri or Google Home or any of that stuff, because yeah, I don't connect my stuff outside the house to the internet. But think about that. You know, people know I do have a electronic, you know, air conditioning control. Somebody's collecting that data on me to know when I cool my house, when I warm my house.
absolutely.
Bad people can actually say, well, he's not at home because he's turned the air conditioning down, and, you know, rob my house. I mean, that's just a simple example, and we laugh about it, but, you know, people can do those things. We've all seen, you know, Macaulay Culkin in the you know, Home Alone, where they're like, oh, look, the lights are on timer at the same time every day. Chances are they're not home. I mean, that type of information is already out there, and now it's being captured in an electronic way. So there's high risk to things that you don't think about, but it's there. And I think the other part too, the unacceptable risk that the EU has come up with, I think it's very important to understand that. And we have seen some things in other countries where the data that's being collected is being used for example, social scoring, right? You can't get credit, you can't get a loan, you can't get a job unless you have a certain social score. That's scary stuff. That's the John Connor, Sarah Connor, I'll be back. You know, we're getting to that approach, but it is very important to think about that. So at SAS, we do talk about trustworthy AI, and, you know, one of our vice presidents, Reggie Townsend, he actually was appointed to the current administration's, you know, AI monitoring board that comes up with recommendations for some of these regulations. And so we take it very seriously here at SAS. And so, you know, here's the foundation sort of what that means. And I'm just going to key on a couple of things. We've talked about a lot of this, but the two things that are really important to me is the transparency and the accountability. You know, humans in the loop, being able to explain your decision making, that data lineage that we talked about, to understand where that decision information came from. And even if it's that model that I talked about with Tennessee Medicaid, where they've you know, ingested or loaded all of their policy manuals into an AI LLM to make it easier for the caseworkers to find things, they still have thought about this. And then their transparency, they put a hyperlink at the bottom of any report back, or any prompt return that comes from generative AI, that you can click on it, it'll actually take you to the part in the policy where that information is. So there's definite transparency and data lineage and documentation around how those decisions are made. That's key. And then of course the accountability as well, right? I know this is what we're talking about here, governance structure, the life cycle of things. Do these models need to be updated? That's something, Jason, I always have question about. And we actually had a question earlier about how often are LLMs going to be updated based on data that's loaded to the internet. Do you want to talk about that for just a second?
Yeah, thinking about that, I think that, with updates, we've got to think of that almost in multiple strata. I mean, that there's multiple levels to which updates are done to these large language models. So in terms of their kind of base training data, when we talk about it consuming almost all the contents of the internet, that happens at a very slow pace. That typically, I think once every several months or so, it seems that OpenAI is coming up with their new version, their new training. But the other thing that it's doing too is that, there's a couple components. One is that you have a lot of manual verification that's occurring, right? There are people who are literally working to manually verify what some of these answers are that are coming through. They're doing quality control. That's constantly being updated. So, that's a constant information feed that's really updating that algorithm there. And then we found too that the more that, we've kind of played around individually on the team and compared results even for the same questions, it's very, very individualized. So I would also say that it's just constantly being updated based on your own activity. So are you going to necessarily load something that winds up into its core training data? They claim not. I don't know. But it will retain that in some form of memory that at least comes back to you. So really the answer is just at what level, right? At what level is that update occurring? So it really can be anywhere from, here and there, somewhere within months to just constantly.
Yeah, I think that's going to be interesting as well. And we've even done some experimentation, right, Jason, around, loading things to the internet and seeing how fast we get responses back, or how, it's kind of the Wikipedia idea, right? Like anybody can have a Wikipedia page, and that's the whole point, is that the general public can actually upload changes to people's Wikipedia page, which can be used for nefarious reasons, sometimes funny reasons, but also just in general, you can go update things and it, loads and is available. So I think LLMs are going to have that same type of situation where, making sure the accuracy of what's out there is going to be a whole job in and of itself. I want to just say to the crowd that's here, we've got about 12 minutes left. So if you have questions, put them in the chat. We are going to have time at the end, but if you start loading them into the Q&A portion of the chat, we'll see those and we can answer them live here, and we will be able to also respond if we don't get to some of your questions, but we'll have time here in just a couple minutes. So I want to just encourage people to start putting questions in the chat if you have them. So what are some of the, John, what are some of the considerations that we recommend to entities out there that are starting to think about their use cases around, should I use generative AI? What are some of the things that we need to be aware of? And we've talked about a bunch of them, but I know this area here is interesting to a lot of people.
So we got there the protection scope, and really it is that when states regulate, they regulate within the state, and they can't do sort of interstate commerce, and this would potentially fall under that stuff, which means the feds would have to regulate it if it's going to be interstate. And what it means is that where you're doing business can change. So if you're in a private plan and you're in multiple states and your SIU is using AI for fraud detection, how it's used in Ohio could be different than how it's used in Oregon or California or Kentucky or someplace else. That will be that you're going to have to start thinking about that, and you're going to have your legal team and your compliance teams understand how you can and can't use such things wherever whatever state that you're actually doing business in. Intended use exceptions, and so Jason always reminds me that generally there is one for fraud detection purposes, which I think is good. So I think it's going to be easier for SIUs and PI teams in a state to get access to data for the purposes of fraud detection, but it might not be. And so I think making sure that you're advocating for your space there so that you do have access to data that you can use, but also being responsible with the data that you do get your hands on is also important. And I think under advocation, Tom and I have talked about a long time that fraud and patient safety go hand in hand. They're two sides of the same coin. And I think that, there's places where you'll be able to use such data that we've been talking about today, like some of the IoT stuff that Marcus shared with us. Is really going to be a space where there's patient safety stuff there that can trump, kind of other considerations. And I think where PI and fraud teams can have access to it and help with patient safety, they're going to want to be able to do that. The other piece is the unintentional use. So we've talked about it. Anything you can write, I can use an axe to chop down a tree and build a house or build a fire. I can also use it to kill my neighbor. It's the same tool. It's how you're going to use it. And so we always have to be careful about how people would use these types of things and how they would turn them loose. And then I really do think I think this NIST AI framework and that pyramid, because I think that pyramid might be in there too, is a good place to kind of go start to learn more about what the industry is saying, and they're setting standards, and NIST is an IT arm. So we understand that they're doing data security and data governance and all of those things. I think it's a good place to probably start getting good primer on these things and beginning to think about them. So I think it's a good place to begin.
Yeah, highly recommend that. I want to make a point too with the protection scope that you consider operating in different states and having to work within those regulatory environments. One of the things that I also take from the EU AI Act is the scope there, that it applies not only to anyone doing business in the European Union, but to anyone who is going to have an impact basically on any EU citizen. So It makes me start to think of then what happens across state lines where, say, you have a regulatory environment in one state, but then you actually have a beneficiary who travels from a different state and then has some sort of claims coverage denial or whatever occurs using algorithms in a different state. Then are you going to be subject to the rules bound to the state where that beneficiary came from? So I think that's just one huge consideration.
And it's a big one too, Jason. I mean, living here in Southwest Florida, we have a lot of tourists that come to Florida for the beaches and those type of things, not the hurricanes, but the beaches. And so they're citizens of the EU. How do those regulations affect if you're here in the U.S. and you get sick or you go to the hospital or whatever it might be? And I think this is where we have to have sort of that risk assessment, understanding what's going on, but also think about how we as investigators would want to use this information. I mean, just as an example, before even generative AI creates any of this, wouldn't it be great if we had access to patients' medical records at the same time as their claims? Now, some places you can do that, some places you can't, but that information, when we're trying to judge a potential fraudulent case or waste and abuse, if we could see what the actual treatments were in the medical notes as opposed to just what's written in code on a claims form, that type of backup, when we could just see that in the system as data, that could make huge differences in how cases are prosecuted or go forward or not go forward. Same information here now with generative AI. That information, will be combined with claims files, they'll be combined with medical records, and will paint that more global picture or that full picture of what the treatments, what the modalities have been, with that patient. And so all of those things have to be, brought into focus as you start to look at it. And so, here's some of the takeaways. We've gone over, but you guys, anything you want to add to the sort of what's going on here?
I think we pounded them for me, but go ahead, Jason.
Yeah. No, I was just going to say just one more time, really. It's just that human oversight component, right? That just seems to be, I think, the biggest recurring theme in everything that I've looked at is that you're constantly making sure that you have mechanisms to keep humans in the loop and really to keep things from getting out of control with automation. I think that's one of the most important.
Yeah, absolutely. Absolutely. So I'm a big advocate for never clicking a QR code. The guys will laugh when I say that because then we put up these QR codes. But this is how you can connect with us on LinkedIn by clicking these QR codes. I promise that they're safe. But we do have a couple questions we want to get to in the last couple of minutes. We have 4 minutes here. One of them came in early. It's about, are there courses that SAS offers or that we can recommend around a novice user who wants to create prompts for AI tools? I'm going to throw that one to Jason because he's our prompt guru and I want to make sure he has an opportunity to tout places he's learned how to do things.
Yeah, sure. So, I mean, really, I mean, I would say actually one of the best things you really can do is just to play around. I mean, to play around with it and just keep trying and be iterative with your requests. I mean, that's one big way to learn. I think it's the best way to learn. SAS doesn't have any official courses that I'm aware of, but there are many out there. Even just in terms of, I think Google puts out some free things too, just to give you general guidelines and how to prompt. I think we've done some other presentations too. We've at least spent a little bit of time on that, going through some of the elements of it. I won't go through them now, unfortunately. But yeah, I would say really, there are plenty of free ones that I think, again, Google itself, a lot of the ones, OpenAI also, I think they provide one too. Not a course as much as they will give you all those recommendations. But the biggest thing that I will say for it is just that, try different variations of a prompt, try creating some context, give the LLM, give it some sort of a role, tell it who or what it is, what its motivation is, and then kind of work from there and just keep moving through it, through many iterations to get the best prompts you can.
Yeah, no, that's perfect. So another question came up. Don't health plans need to have provider approval prior to having direct access to their electronic medical records system to view patient medical records? Is this changing? The answer is yes. You do have to have, the permissions signed over. But one of the things that, has been a big push in the federal government especially has been, they used to call it the blue button thing, but it's really that interoperability where, patients themselves can get access to their medical records and their claims records all in one place with the easy push of the blue button. That's why the name was there. But, also the other part of that is that we have sort of this convergence of providers and payers working for the same companies. And so data is very easily shared between them. And yes, there are guardrails. Yes, there are things that we have to do. But I think what you're going to see, in the future, probably not the great distant future, but the real, pretty quick future, is that in order to have models around, like, for example, value-based care, where you're looking at outcomes and not claims volumes. Well, how do you determine the value-based care payments? Well, you have to actually see the medical records and prove that those type of things are there. So, John, I don't know if you want to add to that, but it's coming. You're going to see that convergence of clinical records with claims records.
Yeah, and one of the things that we do is we do help states build health information exchanges. And so I think we're going to see more of those growing. I think people have been sort of late to get to it, and the EMR systems, EHR systems haven't always been fantastic. But the technology, that space is growing. I think these health information exchanges are growing, and there's going to be rules and regulations about who can see what and who can access what. And I think you need to be thoughtful about that. So I think it's coming, and that's going to make things more complicated. We run predictive models, and we do use the claims data and some like social determinants of health and other information. When you start bringing in clinical data with it, it's going to be good data. It's going to be used, but you have to be careful about how you're using it and what's happening. But we'll crawl, walk, run, right? But I do think it's going to be there. But I think these health information exchanges, the growth there is going to probably bring in more data, whether individual providers are agreeing to it or not, because they'll be legislated to provide certain data. So I think that'll probably be the beginning of that door really opening up.
Yeah, absolutely. Probably have time for one more question. This question comes from a guy named Blaine Hess, who I've known for almost 40 years, I think. So glad to see you on the call here, Blaine. So this one probably is for Jason, because you've done the research. Any exposure to Executive Order 30 in Virginia yet, and the AI working group with that? I'm not familiar with it, but I don't know if that's something you came across, Jason.
But I live in Virginia, so I'm interested.
So I will have to admit I have not. I would do a lot of dancing to try to act otherwise. So no, I haven't done much in terms of I haven't seen much in terms of executive orders at the state level. I'm familiar with New York because I live here in terms of some of their IT usage policy, but no, that's not something I've come across.
Yeah. Okay. We'll get back to you on that one, Blaine. I've got one last question. If AI can help with summarizing a large set of records, I imagine this could be heavily scrutinized if it didn't include human oversight. So human oversight would have to be written into every policy and procedure. Would you agree? Yes, I think we all agree. And that's what we're seeing in a lot of that regulation is around that and having that human touch in there. So
yeah,
we are.
And I worked for a lawyer for 13 years, and I would tell you that where something falls inside the regulation itself, it's how it's constructed, can change its meaning. So it's important to understand that context. And I think that's why Tennessee is putting those links in there so that as a user, you understand that.
Yep. We are out of time. I want to be respectful, and I think they actually cut us off if we don't stop talking. So thanks to everybody for joining. Again, the QR codes that are out there, reach out to us if you have questions. If we didn't get to your question that you put in the chat, we will respond to you directly. And again, check back in a couple days and you'll be able to get the slides that we shared here today. And thank you so much for participating. We had a great time.